I have a guest today. I'm really excited. I've actually sold two small groups, and I've got two others that I haven't even told Dave that have said they want this for January. It's an alternative plan. It's a simple plan. It's easy to do, and it can be sold as individual. With the short term, as I explained last week, the short term's changing the rules. This is at least the third time, if not fourth time, the short term rules have changed since the Affordable Care Act started. We're looking for alternatives, especially if they're older. I get it. Somebody's 26. They're like, I'm not going to get sick, and it's $112 for me to buy the short term plan a month. Even I'll take the risk at, stacking them. But somebody who's 65 or not 65, 63, 62, they're not necessarily willing to take that risk. We're looking for alternatives. I actually have no idea how I found you, Dave. I don't know if you remember. Was it at Benefits Pro? I can't even remember. Was it
Is it
Benefits Pro?
Benny Pro in early May?
That's right. So I went to Benefits Pro in Colorado. It was my first Benefit Pro convention, and I learned a lot about group, and I learned a lot that I didn't know that I needed to work on. There was a lot of interesting and alternative options and ways things are working. So that's originally how I found Dave, and I'm excited to bring him on as one more alternative option for you guys to look at. And if you like this for individual, you can do this for group too. It's pretty sweet for the small group that's needs to have health insurance, but nobody's, they're healthy. And so that's why I have Dave on. So Dave, welcome to the ACA Academy. So I brought Dave. You'll get a link that you can look at. I have the pamphlets. They do have them in Spanish as well. I don't think they have them in any other language, but they do have the brochure in Spanish. I took it to a farm of two, and one was a Spanish speaking guy and one's an English speaking guy, and I could give it to them both. And when they call customer service, they can select a Spanish speaking customer service. So that was really important to me, that I don't just have these alternatives that can't help people that have different languages. Does anybody, I don't know, we got like 28 people on right now. Have you had, what do you think your options are, or need for options are happening? Do you have people that you think aren't going to qualify for tax credit, or I don't know, want more of a PPO type network that you need this, or is this just sign of, maybe it's in the back of your mind? Jill, always. Yeah. I know one of the things I asked Dave to help us with was how do we present the pros and cons of this? Because there are pros and cons to every insurance plan out there. And that's pretty good to just know what that is. You have too many people with chronic and critical illnesses. Wow. We have some, but we get a ton that don't have any, or it's a spouse. One person has the chronic illness, the other one does not. I will split them. They don't need to both pay $1,000 a month for their plan. One can pay 1,000 and one can pay 500, right?
Yeah. So yeah, my name's Dave Nagel. I'm not sure where everyone else is from, but maybe what drew Chris and I together was I'm a Wisconsinite as well. I grew up in Wisconsin, Seymour, Wisconsin, which is outside of Green Bay. So go Packers. But I live in Rochester, Minnesota now, which is Mayo Clinic's back door here. Yeah, so I've been with Redirect Health for over a year now, and I came from a background in ancillary sales. I was a dental and vision guy for Aflac on the broker side, and then I was worked for Emeritus for years, and so that's kind of where I started in the group benefits side. But now I'm kind of doing the I would say, like I said, kind of the alternative, I would say, healthcare plans here is what we're showing here. So, what size plans do most of you all work with? Is it like 2 to 10? Is it 20
Well,
plus?
not so much group for this, Dave. This is
Okay.
for ACA alternative for the individual.
For the individual.
Yep.
Okay.
So,
all right. So let me get my
we're individual and family plans.
Yep.
Gotcha. So we have, as a company, we have 3 or 4 different facets. So we have an individual plan, we have a 2 to 19 plan, and then we have a 20 plus. So we kind of touch all different areas. But so yeah, we're a little different, I would say, because we are as more of a TPA for our clients. So for our members, we have 86,000 members and change. Um, but the difference that's different from a fully insured, like your Blue Crosses and different things like that, is that you actually come to Redirect Health first. So what we're trying to avoid is people loading a kid who has an earache in the car, going to urgent care and sitting there for 4 hours for ear drops, which you knew you had to get, but it cost you $800 to go to urgent care and then another $40 for drops. Whereas we can come to Redirect Health. We have physicians on call 24 hours a day, 7 days a week. So we kind of start with the telehealth, right? We kind of vet and see what's going on. If we need to escalate it, we can certainly do that. And you have 105-degree fever and you feel terrible, or like I said, you broke your ankle, whatever that might be. You have absolutely have the right to get all that stuff looked at. So I'm going to share, if it shares, hopefully. All right. Hopefully everyone can see the Redirect Health Everyday Care Benefit Summary. I'm going to see, is it large enough or does it need to be increased in size? I'm assuming it needs to be increased.
Yeah, if you do presentation mode or that.
Losing my brain here. Well, anyway. So we'll just start going through this. So really simply, it's an opportunity for you as salespeople, as advocates for your clients, to give an affordable alternative. I think that's the biggest thing, is that we want to make sure that it's affordable first off, and then obviously we want to make sure that it covers what it needs to cover. We'll get into pricing here in a little bit, but the first thing that we do is what we call care navigation. So care navigation means that you're going to download an app. So any of the people that you work with, that you sign up, individuals, yourselves, whatever, the first thing that we ask is that you go to your little computer, your handheld computer, and download the app, the Redirect Health app. And here's just kind of a snapshot of it. But what that does is that is your kind of your walking medical business card, essentially. It has all your claims and history in there. It has your numbers if you're going to a physician or a nurse practitioner. You can re-up a prescription on there, for example, if you have a prescription that you're supposed to get, all that stuff. So as you can see here, access ID medical cards, prescriptions, update your information, etc. So it has a rolling Rolodex of everything that you've been doing and that you're going to be able to use for the product. We are available 24 hours a day, 7 days a week. We even have, if you have any Spanish speaking or forward speaking. So AI is an amazing thing now, right? So if we have somebody who speaks French, we can just hit a button and someone can talk to somebody in French, Vietnamese, Spanish, whatever that might be. So a lot of us are going to come across Spanish speakers more so than others, but Chris knows this firsthand. Yeah, so we have the availability to have chatting with anybody of any cultural background and actually be able to talk to them in real time in a language that they'll be able to understand. So with the app, this is just an example. So for example, I have a right knee meniscus that's not feeling very well and trying to ref football. And it's, so I called Redirect yesterday, as a matter of fact. I texted them, I get a call back from a nurse practitioner. She's like, hey, what's going on? And we'll get into the part of the program here, but and I just explained, hey, what the deal was. It's unfortunately it's an injury from my football days at lacrosse, and 30 years old, and they're going to get I'm scheduled to get an MRI at a surgical center, so I'm not going to Mayo Clinic. Mayo Clinic is not in the network. We employ the PHCS network, Physicians Healthcare system, which is over 700,000 doctors across the United States. But Mayo Clinic, being the 600-pound gorilla, is not in the network. They only take Blue Cross of Minnesota, at least here in Rochester. And so we would have to do what's called just a one-time pay or cash pay if they'll do it. But we have other alternatives. So I'm actually going to go to an ortho surgical center here in Rochester, which it's funny. The 3 doctors that run the surgical center are moonlighting as doctors from Mayo Clinic. So instead of charging $36,000 to have my knee scoped at Mayo Clinic, they can do it for like $12,000 before insurance, of course, at the surgical center. And that's the difference that I think with our plan too, is that we want to make sure that everybody knows what the cost of their procedure is going to be before they actually ever go into the doctor to get seen. So if you're going in for a knee, so they're going to tell you, hey, if you go to Mayo Clinic, here's what your out of pocket cost is going to be. It could be $8,000. But if you go to the surgical center, it's going to be like $1,200. Which one would you rather choose? So it's not an HMO. I get that question. It's like, oh, so you guys run like an HMO. You have to go to in-network physicians. No, you don't. It is up to you. We just give you the option. It's like, hey, if you want to go PHCS and save some money, absolutely. But if you have a doctor that you love, you've been seeing them forever, they're a family med, and we're unable to do a one-time contract with them, which we do very, very frequently because there's clinics in small towns all across the Midwest and across the United States that if we say, hey, XYZ company, they're a company in your town that we've been working with forever, and they've got 5 people who want to, join on a plan, and we'll have an opportunity to meet with them. And well, the clinics usually will end up doing a cash pay situation, or they'll end up doing a one-time contract where they'll say, hey, yeah, we'll take do the claims and we'll do all that other stuff with you and for you. Um, so usually it works out pretty well. If you look at the cost, obviously the cost is attractive, right? So if you're looking at the eye everyday care, it's now 157. Unfortunately I pulled up the wrong one. It's 157 for a member now. It went up by 4.5%. And that's another thing. When I say 4.5%, we are predictable. I don't know if you can say that about many of the healthcare options out there now, as you can find pricing predictability. We've been around since 2011, and we have not gone above 5% renewal increases in 14 years. So that's a positive. And the reason that we do that is we want to make sure that we aren't getting a 25 or a 30% increase, because God forbid you actually use your benefits, you get penalized the next year for using your benefits. And it's a double-edged sword, right? And I understand that they have to keep insurance companies have to keep, above water, and they have to stay in the black, but at the same time, we're the ones who have to pay for it. So that's unfortunate. So the predictability that we offer with Redirect Health is knowing that, hey, if you're paying 145 this year, it's going to be, 157 next year. It went up $12. Can you afford that? Most people will be like, absolutely. Well, if it goes up $40 every single year in 3 years, it's gone up over $100. And it's like, well, I was hoping to pay this, and now I'm paying 30% more. And it's like, it just compounds on itself. So so there's predictability with Redirect Health, fortunately. So what we also offer is what's called routine care. Routine care, what we like to call is just preventative, right? So you're going to go in and get a physical, you're going to get a mammogram, you're going to get, so if you see in here annual, I can't think right now. So if you go to urgent care is also included in routine care. So if you do have to take your child in, or you have to go in for an eye infection or whatever it might be, that is also included in the routine care. So when we see here, so we see pre-authorization. If you see the word pre-authorization, that's what it means to come to Redirect Health first. So we don't want, again, this is how we can maintain affordability, is that people aren't going in and getting undue costs when we can hopefully take care of it in-house, because we can prescribe over the phone. We don't have to go to the doctor, so that they can look in your ear and see that you have an infected, have an ear infection, and then it's going to cost you however many dollars to be able to get those drops at $3. It saves time, and it saves the ability of not having to go to the brick and mortar every time that you see somebody. But those options are still there, right? So if you need to go to urgent care, you can go to urgent care. If you need to go get your annual visit, for example, I'm on lisinopril, which is a low dose blood pressure medication. I just had my 6-month check-in, and I called in, and because I wasn't able to re-prescribe, I wasn't able to re-up, I wasn't able to hit the button. It said, well, you don't have any left. And I'm like, well, what the heck is this? And all they did is they just wanted to have the 6-month check-in, make sure nothing has changed. It took me about 5 minutes, and they're like, hey, is it okay if we prescribe, call your pharmacy and get your prescription re-upped? I'm like, absolutely. I got 4 days left. They're like, no problem. So an hour and a half later, I had it in hand. So those are just some examples of ease of use. And of course, it's different, right? So, I mean, people just want to jump in the car and go in and get seen. With Redirect Health, you just make a phone call first. And if you have to get seen and have it escalated, they will take care of that for you. There's 2 ways. Either you can make an appointment and call us and say, hey, I'm going to see Dr. So-and-so. Hopefully they're in the PHCS network. If not, they don't have to be. We reimburse at 140% of Medicare. Otherwise, we will do the actual planning for you as well. So if you don't have a doctor, like for me, for my knee, I don't have a specialist, so I could care less. So they're taking care of that, and they're planning that MRI for me. And I'm not even the one doing the legwork. I'm not calling the doctor. I'm not doing anything. So they're just going to call me back and say, you're going to have an appointment at such and such a time on such and such a date. I gave them a window, and that's how that's going to work. So as long as you stay, we have the $0 copays. If you stay in network in that PHCS network, there's a $0 copay. If you do an out of office visit with pre-auth, so that's the one where you say, hey, I really like my doctor. They're not going to do a one-time offering. They're not going to do cash pay. They're just going to stay and do what they're doing. It's going to be a $20 out-of-pocket cost, which fortunately is still affordable. It's not unknown. People still are familiar with having to pay out-of-pocket costs and copays. If you go out of network and you don't call us, it's a $50 responsibility. Still not the end of the world, but still an out-of-pocket expense that you would incur if you didn't contact us and you went to out of network. People ask me all the time, well, what about emergencies? Emergencies are covered $500 and 20% up to the out-of-pocket max. And what you'll notice here is that the out-of-pocket maxes and the deductibles are reasonable. At least I think they're reasonable. I've seen plans that are unfortunately $8, $10, $12,000 deductibles. Yeah, they're $150 or they're $130, but the onus gets put on the member. So that just becomes a catastrophic plan. Essentially, is that there no people still won't go see your doctor because they don't want to afford the the washer and dryer that they have to buy because they have to go get seen for a shoulder or something like that. So, but nevertheless, with specialists, and I had this conversation yesterday. Someone's like, "Well, what if I do have that earache? Do I have to wait 48 hours to go get seen for an earache?" No. For the routine care, we just want to make sure that you call us. You get us in the loop on your medical journey just to make sure that we know what's going on, what's happening, who you're seeing. Like I said, if we say, hey, instead of seeing Dr. Jones, you could see Dr. Smith, there's going to be no out-of-pocket costs and it's going to be cheaper for you. Would you entertain that? It's your call, right? Most people will say yes. Some people will say no. But on the specialist care, the 48-hour pre-auth, like for my knee, for example, it's going to be like 2 months before I'm going to get seen. So that's usually the specialist usually isn't an issue. When people see the pre-authorization on the routine care and they're like, well, that's going to wait too long. No, just let us know, right? We just have to understand who you're seeing so that we can get ahead of the game, right? Is there going to be a prescription involved? Is there going to be an MRI involved? Is there going to be blood work involved? That type of stuff so that we can add on our end work through some of that with your primary care physician or your urgent care physician that you're going to see. Specialist, again, much simpler, in my opinion, just because you're going to get seen at a date and a time that's going to be convenient to them. It's not going to be convenient to you. Trust me, it's going to be convenient to the doctor. And you're going to get in there and be seen. Like I said, there's a little bit more out-of-pocket responsibility, $50, but most people are unfortunately used to that. So MRIs, PETs, CTs, ultrasounds, mammograms, all that other imaging and everything is covered. On the everyday care, so we have hospitalization, routine care, and hospitalization plus. Fortunately, I'm just so stupid I can't figure it out. So most people, and I say when I say most, I'm sorry?
The preventative?
Yeah, so I would say most people would, I say 85% of our clients, at least on the individual side, maybe even higher than that, will go hospitalization. That's the big one. Again, it's familiar, right? If you're going to get coverage, most times you're not going to want to go just so you can get prescriptions, get your preventative stuff covered. You want to have hospitalization because in case something happens, you want to have hospitalization, right? So that's the lion's share is the middle column here, and I can get this information out to you. I'll shoot it over to Chris, and she can shoot it out to you, or we can have that conversation so you can get this into your hands. You can also go to redirecthealth.com. All of this information is on the website. It is publicly available. We are very transparent with all of our stuff. Most companies, you'll never see the pricing on there. Our pricing is on our website. So if you go on there and say, hey, I've got a person, you can go through Chris, you can go through me. We have what's called an online store. So for you specifically as agents, you can go on and get contracted. And then you get your own personal online store. So redirecthealth.com/ your name or your agency name. And you can go in and you can sign people up at your leisure. You can look at your book of business once you get to that point. If you have multiple people, you can see when the renewal dates are. You can get invoicing. You can get all that stuff on your own personal online store. So one thing that Redirect Health does very well is they do technology. They believe in technology a lot. I guess I just kind of the way that the industry is going. So you can have us all personalized. You will see this exact same thing pop up on your online store, or if you go to redirecthealth.com today, for example, and just kind of do a walkthrough, and all of that is there. So you can get a quote on our website, the whole 9 yards. The only reason I say the online store for your personal, so if you do sign somebody up, you want it to tie to you, so you get the commission. So commission is 6% standard. So that's what our rates are as far as commissions. But yeah, so you want everything to tie back to you so that you have a running record of everything that you've been doing instead of having to go through somebody redirect who's going to try and, hit a keystroke that's going to put you on his case. So this way it just makes it much, much simpler, much more efficient. So it's tailored towards your needs. But yeah, the one I would say excluded services. Let's have a conversation about that as well. So excluded services, unfortunately, for the eye every daycare, there is a 1 year pre-existing condition exclusion. Unfortunately, not uncommon on the small group side. I get calls very frequently of someone, it's like you hit the deer and now you're looking for car insurance, and that happens frequently where people are like, "Hey, I've got such and such coming up. I need to get insurance real quick." And I'd love to help you, but since we are ACA compliant, but we're a MEC and an ERISA plan, we are able to have pre-existing conditions just because our affordability, that's what we're really looking for, is we're trying to keep affordable for the people who can use it. But if you stay on the plan for a year after that, then you're covered. There are exclusions such as type 2 diabetes that's been covered for like 3-5 years, something like that, which is diet. Like my low-grade hypertension, which is just high blood pressure, that's excluded as far as the pre-existing conditions. So some of the really menial ones are still included, but pre-existing condition, like for example, if you have, lupus or something, something is immune deficiency, or you have something wrong with your lungs or something like that. That's good. Unfortunately, the plan's not great for everybody, and that's just being very transparent about that. If you have somebody who's, facing a cancer diagnosis, this is going to be a tough one. But on the same side is that we do what's called care navigation. So with our prescriptions, we try to do non-formulary prescriptions. So if we can't find a generic, and there are some out there that aren't generic, our care navigation team will work on behalf of the member to try and find the best price for that drug. So for example, we had one drug. So we go to Canada. That's a place we go. So we have a couple pharmacies that we work with out of Canada. There was somebody a couple months ago that had whatever drug, I can't remember what it was for, but it was $7,200 a month. And they came and worked with us, and we're like, well, we can't cover that. But our care navigation team went ahead and said, okay, we're going to try and get you best pricing. We went to Canada and we got that price down to $2,100 a month. So it was over $5,000 in savings just because we didn't follow the rules in the United States. We went to Canada. So Canada's worth something. Who knew? But yeah, so I mean, it just, you have to, I'm not trying to say we're manipulating the system, but you have to work the system within the guidelines that are there, right? And I'm not saying we found a loophole. I'm not saying we're doing anything that's not supposed to be done. But when you put time into the craft, you're able to really work through real big opportunities. So when I say that, it's like, so like for drugs, a lot of like the Pfizer's, Moderna's, Johnson Johnson, they actually have, like, if you fall into a certain bracket as far as income, there are scholarships available. They're through hospitals. Hospitals have their own scholarships available that if someone comes in an income bracket, they have to have a surgery, and so they almost write it off as a write-off type of stuff. We find all of those things that hospitals and prescriptions and all of these companies have out there that no one knows about. So that's the difference that we're trying to do, is that we're trying to use what's in place, but we're actually using what's in place and not talking about it, right? So we're being very upfront, very forthright about it. So
you said if you stick with it for a year, then it is covered. Is
yes,
that only on the third one, or is that all of them?
that's all of them. Yep, as long as you stick on the plan for a year,
Okay.
that next year you're covered.
Okay.
So yep. But like it says, care navigation, appointment preparation, coordination, navigation, all that stuff, it is 100% member responsibility, but we're going to work to make sure that either you get a cash price. You're not going to be paying the insurance price, right? You're going to be paying the cheapest price that we can negotiate with the provider or with the facility.
Okay.
The other excluded services, and they're done, and that when I talk about scholarships and different things, organ transplants and dialysis, that's on purpose because organ transplants are really high dollar. We're talking $750 to $1 million.
They're $1 million.
Reality is that virtually no one can afford it, and they are usually supplemented by either government funded programs or by the hospitals themselves. So we investigate that. We will cover the doctor visits, we'll cover all that stuff, but when it comes to the actual organ transplant, again, this is 1/10%. Most people will never face this, but in case you do, that's where the care navigation team goes into work. Skilled nursing means skilled nursing if you have in-home nursing care. You have a nurse coming to the house. Advanced psychiatric care, that's if you're going brick and mortar, you have to go in for, just to make sure that you're telling that you're safe. You have to go in for a couple weeks. That's a conversation as well too.
So
And
that's
then the special
inpatient,
and non-for. What's that?
inpatient versus counseling.
Correct. Yes. 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 And we do the telehealth, all the everything's so telehealth and telemed. That's kind of like the new wave of things like that. We still have all of that in place on the advanced psychiatric. That's 100% covered. Yeah. So, um, so yeah, this is a 10,000-foot view. We can get you more information as it comes available. I see that we do have some chat
So I was
stuff.
gonna say, we have some questions. So Jill asked, what is the time spent on hold for the pre-authorization? In other words, how quickly is the phone answered and a decision made from the initial call to the member?
Well, the great thing is that I text. I don't phone call to Redirect Health. So I shoot them a text, and it's on there. You have the ability to text on your app, and then somebody will call you back. That usually takes between, depends on how busy they are, between 5 and 30 minutes for them to call you back. And 30 minutes, I think the longest I've ever been is 20, but I've heard 30, but it's usually between 5 and 15 most commonly. And then
Okay.
that conversation is, hey, they're saying, hey, what's going on, Dave? We came in, you said that you have throat, issues, whatever it is. You might be having an allergic reaction, whatever. And then like I said, they'll either escalate it or they'll just have a telehealth conference with you and just go, okay, tell me what's going on. What are your symptoms? If they need to escalate it, they will certainly do that. So when it comes down to time, as far as between your first call and care, your first call and the first care is going to be between 5 and 15 minutes. If it needs to be escalated, obviously that'll be a little bit longer if you have to go in and be seen. But again, this is the first domino to fall.
So is there underwriting when we make out the application? Because there says no pre-existing. Is there actually underwriting, or does that happen after the fact if somebody tries to submit a claim?
Yeah, no, the other good thing is that we do not have any underwriting. These are shelf rates. So you can sell this same plan in all 50 states. So there's no difference in cost from Maine to California to Florida to Alaska. Wisconsin or Illinois doesn't make any difference. So there's no underwriting. So that's the other good thing is that that's why we have predictability in pricing, right? Is that we are all in the same pool now. So all 86,000 members are looking out for each other. It's not based on an individual basis. Again, if you use your benefits, you can either get them termed or you have a massive increase. Not a Redirect Health.
And so that answers one of the questions: is what states are these available? So you just said all 50.
Yes. And
So
they're all the same price. So that's why there's no underwriting. So it's all shelf rates across the United States.
So what if in the middle of the year somebody gets a cancer diagnosis?
Yeah, it's the same thing. So you'll go in, get seen, and like I said, we will work out the availability for being seen. Like I said, all the doctor visits are still covered. It just now gets into the prescription stuff. It gets into the drugs, right? Okay. That's when our care team will go into and make sure that we find either lowest price stuff or trying to find making sure that the radiation or the chemo drugs, whatever, if we have to go to the Philippines, we're going to find the cheapest drugs possible. I know you all seen it. I mean, you can see $100,000 a month in cancer drugs when you're going through it. It's a horrible deal. But yeah, we want to make sure that no one's having to declare bankruptcy to get their coverage.
So we don't see any mention of maternity. Is that excluded? Is that included?
Nope. Maternity is covered as long as you're not pregnant before you go on the plan.
Okay.
You just
we're not signing anybody up in their 6 month of pregnancy.
Yes.
But if
so it's
on this plan,
it's a plan thing. Yeah.
So
unfortunately, that's a pre-existing. So if you come on the plan and you're pregnant, we'll cover the doctor visits, but we're not going to cover the maternity side of it. So you just have to plan accordingly.
So how is the mental health part covered? So I know you said inpatient is a little different, but if somebody wants to go to counseling, is that a specialty? Is that
No, counseling is included. I ran across this again last week. So like if you have a therapist or somebody that you're seeing, a psychologist, whatever that person is, that is covered. That is covered under the specialist. You're right. So if you're going to a therapy person on a weekly basis or whatever, there's going to be some out-of-pocket costs with that, but you still have the coverage being able to go be seen for it. And that counts towards your out-of-pocket deductible and max.
Excellent. Oh, commissions. So what are the commissions?
Yep. They're a flat 6%, 6% commissions. Yeah, and renewals the same thing. So it's 6% every year. It's not 6% up front, 2% every year, something like that. It's 6% every year as long as it stays in the books at 6%.
So that's great. I know we always wonder about that. It's pretty much level. I'm trying to see if there's any other questions. So you're asking, Jill, how's this different than PALIC? PALIC is an indemnity plan. This is not, this is not an indemnity plan. Indemnity plan pays a dollar amount for when you go to the doctor to you,
Right.
not a copay. If it says it's $200 for a specialist, it doesn't matter what your bill is, they're giving you $200, whether it's a $500 or $2,000. So New Era is an indemnity plan. Manhattan has an indemnity plan. So this is not an indemnity plan. And I will tell you the PHC, whatever network, there are a million layers to that, I swear. So I clicked on the brochure, which I did send the link in there. On the brochure, you click the link and it takes you to the Redirects network. It's not the super limited network that you sometimes see with some of the mech policies that are out there. This one is a bigger network. But in your area, or like he said, you know, if you're in the rural, I mean, I live in rural. If there's somebody who's like, well, you know, Bob Smith's been my doctor for 50 years, they will
Right.
work with that, you know, and they usually will be able to either do the cash rate or do a one-op.
Yeah.
Is there a cap on the benefit, or yeah, cap benefits, $1 million, you're kicked out, or is it unlimited?
No, it's unlimited. So we have reinsurance, right? We're reinsured up to $750,000. So most people will never reach that. I pray that you never do.
Yes.
So yeah, we've never come close to that. We've only had since 2011, we've only had six claims over $200,000. So it's
All
crazy.
right. And the network, Virginia, is already, we already talked about that. It's in the brochure, which I put the link on there so you can all see the brochure. How do you, I guess it says, so is there a number,
Speaking of that, I'll see.
is there any limitations for visits? So like I did see, it was 12 free chiropractic visits, right?
Yep,
So
you get
there
12
are some,
chiropractic visits. Yeah.
is
So
there
I
any
see
other?
the MEC. Does it fall under major medical or MEC? It's minimum essential coverage. The routine care is the MEC plan. Hospitalization is an ERISA plan. So that's how those two kind of work. So yeah, the routine care, which is only the routine care, that top portion that we were talking about, that's the MEC.
Right. So I personally don't deal with mech unless somebody's coming in with like a ministry plan. And what they're missing is the annuals and the preventative, then I add a mech. In today's day and age, I rarely do mech only. It leaves people so vulnerable. I don't care if you do a mech and a hospital indemnity plan, it could work, but you better know your network. My network, Aurora, will balance bill everybody to Sunday. So I will never sell a mech and an indemnity plan only in my area when there's no caps on income. Now, 2026, we'll talk about that. If the income cliff comes back and stuff like that, we can talk about that. But right now, I personally don't sell mech because of my area. Now, if you think mech works well and you got this great indemnity plan and somebody's willing to do that, as long as they understand the risks, that's fine. Mech or indemnity plans pay a dollar amount to you, but there is no cap. There's no max out of pocket. There may be $1 million cap on how much they'll spend on you, but there is no, hey, once I reach 6,000 or 9,000 or even 20,000, I don't have to pay anything. So that's one of the issues with the indemnity plan. So how would
And
you,
and
how
the,
would
and the
COVID,
and the hospitalization the hospitalization plan is ACA compliant Part A and Part B. The MEC, the routine care, is Part A only,
right?
but the ERISA plan covers Part A and Part B.
Sharon wants to know how you would handle COVID or how the plan handles COVID.
Same as any other plan. If you have to go in and get seen, it's kind of the same. You just give us a phone call. I mean, if you need a testing kit, we can figure out a way to order those, that type of thing. But it's not going to be different than what you've faced in any plan that you've used up to this point. And we are 1099 friendly, so that's another thing. You don't have to be a W-2 employee. We're 1099 friendly. So if you have somebody who's working straight commission, which we all know who does, then you can offer them a health plan. That's good.
Yep. Someone else have a question? Gwen, we did talk about prescription drugs.
Yeah. So prescription drugs, really quickly, again, we're looking for non-formulary stuff. So we're trying to go generic. We want to have people buy their prescriptions where they get their groceries historically, because of CVS and Walgreens usually are, 3 or 4 times more expensive where you have to get your prescriptions from.
It is.
But yeah, we try and go non-formulary generics through the grocery store. Now, again, if we don't have that ability and that's only offered Ozempic is a big one right now, right? There's no alternative to Ozempic, and it's $1,700 a month. If we have to go to Canada or New Zealand, we'll have to go ahead and do that and get some savings that way.
Right.
Can I ask one more questions?
Yeah.
Sure.
So this is not like, do you have to work or can you just be retired or not working?
Yeah, we do not offer over the age of 65.
Okay.
And again, most people put their own stipulation on an individual basis, completely different, right? I mean, you're just looking for healthcare. There's no proof of employment
No
on the
proof of
individual
employment.
side.
Oh,
On the
good.
group side, definitely, but on the individual side, not so much.
Thank you.
Yes, no problem.
All right, so I put Dave's contact information in here. You can email him, contracting. He's got a link to schedule on a meeting if you want to have more one-on-one. I do have a question for you, Dave. So I'm on my link, right? Both the employer side and individual, because I like to do both. And if I hit enroll now, I only see two options. I don't see that third one. And I wanted to know, I mean, so you had the brochure up and the third option, has the little extra.
Hospitalization plus, yeah.
Yeah, so what is that plus and how come I don't see it when I am on my page?
They honestly, Christine, they might have changed it. Usually, for whatever reason, October 1st is our changing time. Why they want to change stuff in the beginning of fourth quarter is beyond me. It's not my decision, but they might have changed something in there as far as, again, that brochure was before October 1st, unfortunately. So yeah, that might just have the two options. And that used to be that way. The only reason that we had the plus in the individual plan is because somebody got a hold of our owner and wanted to offer it on an individual basis, a really big broker from Aon.
Right.
And that's why we offered it. And they probably went back to the reality of the routine care and hospitalization. Again, the hospitalization care, that's 90% of the people are going to go to hospitalization.
Right. And if you stick with it for a year, then you don't have to worry about the pre-auth.
Correct.
Yeah. And I don't see the hospitalization plus on the group site either. So, which I know I just sold that, but maybe they redid that too. So
I know it's available on the group side, 100%.
okay, so I was like, wait a minute, and it's just I'm just
Yeah.
looking at the brochure, but yeah, so because I got a couple people, like I said, I'm going to be signing up, but
Yeah.
pretty much. So I know somebody's asking about the attention deficit medications, anxiety, depressions, all of that. Do you know? Are those formulary typically tier 2 or tier 3? For you guys.
And we use Drexy and Kroger. So what we usually do is go on Drexy and we'll try and find the best price through there. And that's where we can also find the alternatives to that. So we'll have a conversation. Our care navigation will have a conversation going, okay, is there an alternative to XYZ medication? Is there a kissing cousin that we can use? So we'll have a conversation. Again, a lot of stuff goes on behind the scenes that you'll never feel, you'll never have to touch. You just say, hey, I've got this going on, or I need to fill this prescription. And a lot of times it's between us. So we have doctors and our claims team talking to doctors. That's a good thing because that eliminates you having to be the third party. It's like, you talk around the campfire, and by the time it gets back to the original person, somehow, you were abducted by aliens and cows are now ruling the earth, So with this, the doctors talking to physicians, it really eliminates that middleman. And what they can talk about in 30 seconds would take us, 15 minutes. So that's why we have that navigation team the way it's set up.
So two questions that are kind of next to each other. Is a social security number needed, or do we need to have immigration documentation for people?
Social security is needed. As far as documentation, I know we have on an exception basis got undocumented in there, but it's a lot messier. So I would say steer away from that. Again, I got so many stories. I'm not even gonna get into it.
Right.
So, but yes, I would stick with the social security number for now.
And your Calendly link is not working. So I just clicked it direct and it still didn't work. It just says the URL is not valid. So the one I have for you is the Dave dash last name dash RDH.
Yeah.
30 minutes.
Let's see if I can.
And I just the information that I sent for Sharon, it is in there. It's the second thing down from his name. So if it's got his name, his address, and then the email. But I will put that again. And again, this will be, how to do this will be on the YouTube channel. His phone number's on there, email's on there.
Is there
I think
a
I have to go into
contracting
Calendly
link?
and update it. That's my issue on my end. So I apologize for that.
What was that?
Is there a contracting link? I didn't see it on their website. I'm looking on there.
I sent you the
Unless I
email
missed
to
it.
call him.
Oh, email to call him. Okay.
Just or
Yeah,
email,
let
just
me
email
know
Dave.
because it's pretty simple. So what happens is that we usually go through, we'll get your information, whatever, and I'll just go through. We use PandaDoc and send you. It's a 2-page contracting with the ACH so that you can get paid. Sign them, you send them back in. Your contracting literally will take 24 hours on a good day, so it happens pretty quickly. That online store will be created about probably within a business day of you getting contracted.
Yeah, it
So
was
it's
quick.
yeah, so yeah, 36 to 72 hours somewhere in there that you'll get all your stuff. And you do not have to be contracted. So you could talk about this with clients today. So you do not have to be contracted first. If you want to get paid, you need to be contracted.
But you can start talking about it.
Yeah.
I mean, especially if you're looking at November
Yep.
1st or December or January, start talking about it now. So any other questions? Like I said, this is kind of new, it's kind of different. I to me, how I positioned it is we have one of the things I've said is we have this in our hand all the time. So when you're suddenly going, man, my foot is freaking killing me. I need to go see a doctor. Maybe I should see a doctor. You can just push a button on your phone and talk to them. And they may go, oh, we know exactly what that is. Try this first. Well, now you didn't just spend time going to a doctor and then having them charge you, and then you're trying the exact same thing first, right? It's not about redirect saving money. Yes, but it's about us saving money and like in the convenience. So people have to get a little bit of different mental, just think about it differently. I do think, we're starting to get there, but it's like, this is it. Like your doctor's right here. You don't have to do a bunch of, by the time you start, I'm like, if you start thinking, I don't feel good or this hurts, sometimes we're so busy that it's 3 weeks later before we think we should call the doctor, but it's right there on our phone. Instead of, all right, I got to find an orthopedic in the area or a podiatrist or a dermatologist or whatever, you can just do this and then let them handle it. So that's one of the things that I like. And it's, again, how would you use it? Just think, imagine you, hey, if I sold this to you, how would you work? So, and it does.
I had my notifications turned off. My schedule meeting is now active. I just
Okay, so there you go.
So I apologize. Yeah.
So
well,
that
I'm glad,
Calendly link
no,
is now working again.
yeah,
Who knows?
no one ever tells me stuff. So usually I find out after the fact. So I'm glad we had this conversation because I don't know
Yes.
what personally. So
Me too. Like somebody said, your phone didn't work. And I'm like, wait, what? But
yeah.
Sharon is contracted. You just haven't sold anything yet. I have sold, like I said, 2 groups. I haven't sold any individuals, but I haven't had those conversations yet, but I know they're coming. I have some already scheduled for the people who were on short term, and year after year, I'm switching them. Hey, maybe I don't have to switch them anymore. No, the 23-year-old may not want to pay $400 when I can do pivot for 150 a month times 3, the 4-month period, So you're, again, to me, it's about options. I'm bringing you options. I like options, and it's very responsive. I mean, I talked to Dave. I think I sent you emails way after hours, and he's responding. So I'm like, "Why are you working?" And then I'm like, "Well, why am I working?" But
yeah, I was just saying, why am I getting an email at 10:30 at night, Chris? What's going on? So
yeah, exactly. But that's when I'm not working. So these just auto renew, right? I mean, if somebody's got it, they got it until they
yes,
tell
yeah.
you don't
They
want it.
just until you say no, it just keeps going. So
Now, Nell's asking this, but this is a good question. So if I sign somebody up for November 1st, is it November 1st through October, or is it November to December and that it resets on, when does that
it's gonna be plan year.
plan year? Okay.
Yes.
So Virginia's saying, where does the cheap version fit in? Again, ministry plan, somebody already has something, a high deductible plan. Maybe they're at their group and their group plan is affordable and they have to take that, but it's a high deductible plan. And they were like, I don't have any money for some of this. You could do a MEC, that cheaper plan. It shouldn't be sold by itself. I mean, I guess it's better than absolutely nothing, but
the only time I've sold the MEC plan is literally construction companies where they're like, they've got 19 to 25-year-old men. They're offering it for ACA compliance, and they'll sever a foot. They still don't want to be seen for it. So it's just it's one of those deals but they just want to offer something to say that they're offering something. Yeah, the routine care is very little, and honestly, I was an Aflac guy. Well, I didn't sell Aflac, but I mean, I was in the broker side of things. But if you have a voluntary benefits plan, if people are wondering, well, what about my accidents, hospitalization, stuff like that, it does pair well with a Colonial or an Aflac or a MetLife, whatever, voluntary benefits.
principal,
you
whatever.
work with, it works really well together with them, and it sews up those holes. Look at the duck, man. It's dumb as hell, but at the same time, the medical gap thing is a real thing, and it does it kind of emboldens. And now this way, you have another revenue source, and you have another opportunity to bring to the table. And again, we all know about persistency. The more things you have on the table, the harder it is for them to get rid of it. So, just a thought.
And I am assuming because there is a year for pre-existing, this is available all year, right?
Yeah.
Yep.
Yes, ma'am.
So this, I'm assuming, we'll see if the healthcare.gov turns back on the required paperwork to show an actual SEP. So you get somebody who's like, oh, I haven't had insurance and I kind of need it now, and it's May. We're not going to get you in. You haven't had insurance in 7 years. They're going to put that require stuff documentation back, I do believe. So here you go. This is something you can do. You don't need consent because it's your link. This is not this is not a marketplace plan. So they're not selling it through the marketplace. They don't have to go under the regulations of the marketplace. If you're on the marketplace, there's a bunch of rules and regulations. This is an off exchange. It's got nothing to do with the marketplace. So it's compliant because of the MEC. It's got the part A, part B if you do the more expensive one, but it's not going to run on the same chassis as our ACA plans. If you have somebody walking into your office, though, who's got major medications, they've got Crohn's, they've got lupus, you wouldn't do this. You would put them on the ACA. That's what it's for. That's why the price is what it is, because they can afford that. They can do what they want. They can go where they want. And their pre-existing is covered. Jill says, why is the employee only more expensive than the individual? If you're looking at employees versus individual, that's why. It's an individual. And employees under the employer plan.
Right.
And there is 2 different price points for employees. There's the 0 to 19, or not 0, 2 to 19. Not going to get a group of 0, 2 to 19, and then 20 plus, right? It's just 20.
Right. Right. So yeah, and the individual, I forgot, obviously you can see that the individual is age banded when you get to the hospitalization side. On the group side, it's one price only. There's no age banding. It's just one price.
Yeah, which makes it a really easy
$434 for the individual. So,
yeah. So Gwen said, so the underwriting would happen during a claim, correct? Which is where you expect to see.
I mean, that's where the negotiations go on. I guess if you want to call it underwriting, I guess you can call it that. But yeah, that's where the claims are involved with the facility or the provider. Yeah.
Yeah. So that's where they would look to see. You've had 7 years of something that's a little different than, hey, I've never had anything. I just got a diagnosis. All right. Any last questions? So I got your.
Also, the 20, if you do ever stumble upon a 20 plus case and it's 20 eligible, not 20 enrolled, there is no pre-existing condition exclusion. Pre-existing only comes from the individual in the 2 to 19, whereas anything 20 eligible, that pre-existing condition exclusion is waived.
And you said 20 eligible, doesn't mean all 20 have to enroll.
Right.
Which is one of my new clients that I have. They're like, oh, I kind of like this. We have a lot of healthy people. So
and the participation requirements are 50%. So if you do get into that group space, if you've got 5, we'll go down to 2. So a lot of small groups, like they only go down to 3 or 5. We go down to 2 enrolled. So it's a flexible plan on the small group stuff too.
So, well, thank you very much, everyone. Thank you, Dave. I was really happy you could come on. Again, options, and this one's kind of unique and I like it. The more I look at it, the more I'm like, can I do this for me? Because I like to be able to just have somebody else maybe do it for me. Like you, I'm like, I need some MRI knee stuff. I don't care where I go. I just need to know who I can go to. And if I can get surgery and an MRI for, $500 because there's an MRI plate, let's do it. So reach out to Dave if you don't see his contact. That will be on the YouTube. And like I said, I will be sending out one mass email to everybody to say thanks for the coming in every Thursday. And that'll come from my North American email, just because that one maybe doesn't have the block that I'm having with the ACA one. So thank you very much, everyone. Appreciate it. If you have any questions, shoot me an email and I will see you. Happy open enrollment.